An article published on October 24, 2016, found on the New York Times website stated that under the Affordable Care Act, health plans will increase by around 25%. Basically, people will be paying more for the same coverage. The Obama administration responded both 3 out of 4 consumers will be able to find healthcare plans for under $100 a month. Also, federal help will be available to citizens who qualify. The policies purchasable for 2015 will become available November 1st. If a citizen chooses not to buy health insurance, they could face a fine starting at $700. Both candidates have made promises to change healthcare. Hillary Clinton supports the Affordable Care Act but doesn't stand for the increase in prices. She wants to expand the government support so citizens don't have to spend out-of-pocket money. As for Donald Trump, he would prefer to scale back government involvement so that citizens are more reliable for themselves.
Before Obamacare, marketplaces opened for business in 2013, insurers were worried about the financial impact of an untested risk pool. In insurance, a risk pool comprises everyone who participates in the insurance plan. Insurers have been banking on younger, healthier enrollees to sign up for Obamacare coverage because they use fewer services, but there hasn't been enough to balance the large number of older enrollees who need more services. A 2015 report from consulting firm McKinsey & Co. found that insurance companies lost $2.7 billion on the individual market, in part because they had to pay for more claims than expected. Patients who are in the top 5% of healthcare spending account for 49% of healthcare expenditures, according to the Kaiser Family Foundation. This leaves insurance companies at a loss. UnitedHealthcare, the nation's largest health insurance provider, anticipates it will lose about $650 million this year from offering marketplace plans and announced it will leave the market in 2017 along with Humana and Aetna. By contrast, some insurers, such as Anthem, have actually made money by offering marketplace plans. Anthem is considering expanding its plan choices in 2017, which could offset the drop in coverage from companies leaving the marketplace. Insurers remaining in the market, such as Blue Cross Blue Shield, are filing for large increases in premium prices to counter the large profit losses from this policy. Blue Cross Blue Shield reported a 75% profit loss. In some cases, premium rates may jump, double, or even more to make up for financial deficits. In North Carolina, for instance, Blue Cross Blue Shield lost about $400 million during the first 2 years of the Obamacare marketplaces. The company raised its premiums by an average of 30% in 2016 to account for the loss. All of this has a large effect on people around the nation, especially those in rural areas and southern states. As companies like UnitedHealthcare pull out, 30% of enrollees only have 1 or 2 health insurance companies to choose from. A single plan on the marketplace means there is no competition between companies that could help drive down prices for consumers. How much consumers can pay for health insurance and whether they will have enough options to choose from remains to be seen as America heads towards its next enrollment period this November.
Public health is on the decline. One of the major reasons for the increase in premiums nationwide has to do with the failing condition of public health. Due to a combination of poor lifestyle decisions and chronic sickness, healthcare providers have been forced to increase premiums in order to keep up with the population. The United States has achieved remarkable progress in reducing the portion of adults who smoke tobacco, with the rate of daily smokers coming down from 19% in 2000 to 14% in 2012. This is the lowest rate among OECD countries after Mexico, Sweden, and Iceland. Smoking has been linked to certain types of chronic disease, including lung cancer. Studies have even shown that secondhand smoke can cause cancer as well. Even though on the decline, this type of hazard can harm unsuspecting people just by taking a breath. Obesity rates among adults in the United States have increased greatly to reach an astounding 35% in 2012. This is up from the 30% in 2000. This is the highest rate among any OECD country. As is the case in several other countries, the obesity rate in the United States tends to be higher among disadvantaged socioeconomic groups, especially in women. Obesity is often the catalyst for many chronic, lifelong conditions. Mortality from disease, including cardiovascular disease and many cancers, increase progressively once people become obese. Obesity is a lifelong condition, and once diagnosed, there is nothing you can do to get rid of it, besides changing diet and exercise. Obesity by far is the greatest problem facing the U.S. health, and until the U.S. changes its lifestyle patterns, these numbers will continue to rise and bring with them a multitude of problems. The United States ranks 26th in the world in terms of life expectancy. Based on this statistic, we can conclude that the U.S. definitely has room for improvement. While life expectancy in the U.S. has increased by 2 years since 2000, this was less than the 3-year gain registered across OECD countries. Slower progress in life expectancy in the U.S. is due to poor related health behaviors, as well as living conditions that affect a significant portion of the U.S. population. The United States ranking in categories like tobacco usage, obesity, and life expectancy are great indicators for where our country is at. Obamacare made healthcare increasingly accessible to the American citizens, in turn causing more and more at-risk people to shape premiums. Those with pre-existing conditions were no longer denied coverage, forcing premiums across the board to take the hit for a lifetime worth of hospital bills. Everyday accidents, disease, and chronic illness caused people to be hospitalized and take out bigger and more expensive healthcare plans. The only bright side, perhaps, is that many of these issues have to do with lifestyle or are preventative. Simple changes and an increased awareness in the public sector can have a positive influence on the market and healthcare plans. Changes in the media, food industry, and a focus on preventative medicine could potentially alter the healthcare field and save consumers tremendous amounts in premiums.
Close to 3 million baby boomers will hit retirement age every year for the next 20, making this the most powerful operating force in the healthcare system right now. This poses an issue as many voids will be created in clinical care and healthcare management. By year 2029, there's expected to be a 73% increase in the number of Americans over the age of 65. This will test the strength of new care plans such as Medicare due to the large number of people expected to switch over from their current commercial plans. These findings support an increased likelihood for continued rising healthcare costs and a need for increased number of health professionals as baby boomers age. To prevent this from happening, we need to look into raising the current retirement age. This would give us a short-term financial support.
The cost of healthcare
need,
premiums are
but
substantially rising in the United States.
More money seems
Part of this
likely.
has to do with the cost of the process of healthcare. First, an overwhelming amount of money, about 19 to 24% of healthcare spending, has to do with administrative costs. These costs are much higher than any other country. Administrative spending deals with billing, communication, and other basic forms of any other company. Additionally, another process in healthcare that isn't cheap is drug costs. Over the past years, insurance coverage for more and more prescriptions has lowered, leaving citizens with no other option than to pay out of pocket. Lastly, access to technology is extremely costly. While in the US, we are very modernized in technology, many other European and Middle Eastern countries unveil even more technology that the United States invests in to keep up with the medical world.